office hours. Good Wednesday morning to everyone. A couple of notes today. First of all, the chat box is open for questions. Also, I want to just let everyone know that we do have a hard stop of 10 a.m. today because we have our statewide planning and policy council meeting statutorily required. So we never want to overlap any meeting with that one so that we can make sure that everyone gets there. So we do have several questions that have been pre-submitted, and we'll, of course, get to those in just a second. And as I mentioned, the chat box is open for additional questions and comments should you want to make them. And we'll start the way we always do. I'll turn it over to Commissioner Turner to say a few words. Commissioner, good morning.
Good morning. Thanks, Kara. Good morning, everyone. Thanks for joining us again. As Kara alluded to, we do have a hard stop at 10, so I'll be brief. Just want to say again, thank you for joining us today. Thank you for your questions and contributions. We certainly want to make sure we honor that. I know there's going to be a lot of questions that are going to pop up in the chat box as well. We're going to keep an eye on that, make sure we get a chance to answer those. It's been a really busy week this week with the governor's state of the state, and as the budget starts rolling out, a lot of good information in there, and obviously we're going to be sharing that with you as we get more information on that. But today we've got some questions that have been submitted, and I want to make sure we get to that, so I'll stop there and just say thanks for joining. I'll pivot back to Kara.
Okay, so we'll jump right into those questions. And the first one, I'm going to turn it over to Pat Nichols. The question is, will the DIDD survey team be looking at the new transition and other new policies in June surveys? Pat, if you'd like to provide some insight into this, I'll turn it over to you.
Thank you, Kara, and good morning to everyone. The answer to that question is no. For June surveys, we will not be looking at any of the new requirements that are related to the alignment and integration process. Those, the first of those changes take effect in July, and so for June surveys or anything previous to July, we would not be looking at those changes. Just to clarify just a little bit further, for HCBS 1915C providers and ECF providers, as of the 1st of July and then going forward for the foreseeable future, your survey process will remain the same as it is now. We are working and will continue to be working on an aligned quality review process that will encompass both programs, but that work will continue past the 1st of July. So we will keep you posted as to how these things are going, but for now, the answer to that question about June surveys or surveys previous to July is no. These changes will not be taken into account. Thank you, Kara.
Thanks so much, Pat. Next question is, when will providers receive the new rates for the July 1st integration changes? I will turn it over to Jordan Allen, but Andy Kidd might also have something to say. So I'll turn it over to one of you.
Good morning, everybody. Thanks, Kara. So very similar to the way Pat responded, no changes in rates for either the 1915C program or ECF program are planned for any portion of the integration. While the integration is planning or is going forward to occur on 7/1, that again will deal mostly with ISC services and certainly the intent to produce a single approach to billing and some of the other things we've talked about. Rates will be unaffected by the integration. Andy, do you have anything you want to add?
No, actually, Jordan, I think you hit it. Thank you.
Thanks to you both. Okay, medication administration. We realize that classes are at a minimum, but why is the schedule so late in being published each month? For example, it's February 10th and the February schedule has not been posted. We are looking into this issue. We don't have a good answer right now, but we will look into this issue and make sure that we are able to get some answers for you on that. So thank you for the question. Where can I find information on the NCI surveys to share with persons supported who have been selected, their families, and staff? We have Robin Wilmoth on here. Robin, hopefully your audio is turned on. We have made you a panelist, but I think she can provide a little bit more insight on that document and the NCI process. Robin, if you're with us, please weigh in. I know you are very passionate and excited about this subject. And you're on mute, so you might want to unmute yourself.
Okay, is that better? Can you hear me now?
I got you, Robin.
Okay, thank you very much. What has happened this year with the National Corps, and I apologize, I've got different screens set up. I just got off an ISC meeting talking about this. With the COVID-19 situation, which happened in the year 2020, as we were going into the 2021 surveys, we realized that there were a lot of different steps that were going to have to be taken this year. And one of those steps was because the in-person interviews is not always going to be the best option for people supported to have the interview. So National Corps Indicators in the ARC created a video format for the person to be able to participate in the interview if they chose to. And this video format is an option. Now, the option is still available if the person states that they do not want to do the video format, that they want to go ahead and have the in-person. Well, the ARC can do that, but social distancing, those restrictions have to be put in place. So that's kind of what's going on right now. When we realized this was going to happen, we announced this in September of last year, and a document, which is ultimately a PowerPoint, was created by the National Corps Indicators that is titled, "I'm going to be doing a video interview this year." And it's a very simple PowerPoint that can be shared with the person supported, their provider agencies, or the families to understand how that video interview could happen. Now, when we start the National Corps Indicator survey request, we always start with ISC case managers first for the background survey because it's a more extensive survey and there's more information that's needed. All of the ISC agencies and case managers for people who were randomly selected for the survey have received this PowerPoint. All of the ISC agencies have sent their background surveys back. So now we're in the process of sending out the surveys to the provider agencies. This process started last week and is going into this week. So I'm probably about 50% of getting those surveys out. Attached with that survey request that you will receive as a provider is the PowerPoint that explains how to do the video interview if that is the option that the person who is being interviewed chooses. I thought we did send it out in open line, but maybe we missed it. If we did, we can get that PowerPoint back out in open line for providers. But additionally, if you are a provider and you have not received the email from me yet requesting your surveys for pre-surveys, you can email me and I will be happy to go ahead and send you the PowerPoint. It's just a simple 8-page that you can print off that you can share with your direct support staff. You can share with the families or the person supported to understand how to do the interview for that video conference if they would like to do it that way. So that's pretty much what's going on. I will let you know that the interview process is, as you can imagine, with this being the first year of being done video, with the internet capabilities, with the restrictions of where a lot of people live in areas that are very remote, having access to computer internet, it is going slow, and we're working with that. But at this time, we're meeting weekly with NCI and ARC also to help them overcome some of the challenges that they're doing as the interview and provide what support we can. So you're going to be getting it if you've not got it yet as a provider, but we can get it back out in open line, and you can email me privately and I'll be happy to send it to you.
Thanks so much, Robin. I think that was helpful. So thank you. Thanks for joining us today and letting us make you a last-minute panelist.
You're welcome.
Okay. We'll work on the questions again. We've got, has the IVD 18+ criteria for vaccines been extended to those who can live independently? Dr. Davis, I think there's a short answer to this one.
Having trouble with the unmute button there, Kara. But yes, I mean, no, there is no change to the criteria that had been established previously. This question's not under review, to my knowledge, by Department of Health. They are the ones that are deciding who would be advancing to the next level. Be happy to talk to somebody and get more information on this if we feel we need to discuss this with them, but this has not been a target group up to this point. So, Kara, that's the answer to this question for now.
Thank you very much, Dr. Davis. Next question I'm going to go to Jordan for, and once again, Andy might have some more he wants to talk about there. When all the waivers are under the auspices of DIDD, will all of the DIDD or DSP rate structure be equalized? Jordan, do you want to take a stab at this question?
Sure. And it's a good question. I think it gives us the opportunity again to draw the line of delineation between alignment efforts and what we've talked about largely in terms of single system development. So under the alignment efforts that will take effect on the 1st of July, the ECF program and the 1915C program effectively retain their own kind of individual autonomy. So those programs, the rates, the services will be the same. As we move forward, certainly the intent is to develop a single system approach that would, for instance, have a single menu of services. There would be a single set of program expectations. And so at the point at which we're able to develop and implement a single system, there would be a single set of rates for all those services, and obviously the DSP wage component in those rates would apply to all DSPs. That will not have any impact on the alignment, which is, again, is scheduled to happen 7/1. Andy, I don't know if you have anything additional you want to add.
Yeah, the only thing that I would add to that is, to your point, as we go through the alignment process and we have more of a single service model, as we make increases to DSP wages, it's more likely that would be spread across all of our service areas, right, as ECF and the 1915C waivers are pulled together. So as we make additional requests in the future, that'll help all of the direct care professionals. Thanks, Kara.
Thank you both. Okay, one more question that was pre-submitted. How will the new start affect ECF groups 7 and 8? Dr. Davis, I know that you are very passionate about the TN START program, so I will turn this over to you to talk about.
Yeah, very excited, and Michelle Bagby and I have been interviewing lots of applicants for our positions across the state over the last week. We've got several others scheduled for tomorrow and Friday, and hope to be hiring people for those positions in the very near future. So it's very exciting where we are with this. We have discussed some about our interface with groups 7 and 8. The way that START works is what we do is fill gaps. And in the group 7 and 8 services, there are expectations of the agencies that provide those services that they will do some of the crisis responding that's required. So we don't want to duplicate that those elements of the service as it stands currently. However, we are there to support group 7 and 8. We are going to be engaged with them in transitions into and out of group 7 and 8, and to the extent that it's needed or appropriate, we may interface with them while people are in group 7 and 8. So we're still working out some of the details associated with our interface with group 7 and 8 and with the MCOs and with the whole system in general. But those are some of the ideas about where we are right now. Kara?
Okay, thank you very much. Okay, so we are done with the questions that have been pre-submitted, but I do see Don has a question, one that I'm sure is on everyone's mind too, which is we're asking whether or not we can discuss the governor's budget as it relates to IDD services. And I think that we would be happy to. So Andy Kidd is going to kind of go through how IDD services will be impacted by the governor's proposed budget from the state of the state. Andy.
Absolutely, and great question. Really excited to tell you guys about everything that was proposed in the governor's budget. We'll also put this in open line in a narrative so that you can see it in writing, but I'll go through them pretty quickly. If you have any questions, I'm happy to answer them. The first is the direct service provider wage increase. It's been proposed for $10.50 hourly wage, which is an increase of $9.7 million in state funding and $28.8 million total. The next line item is telehealth services. So that's our Station MD contract, which is a total increase of $85,000. We also received the Tennessee Believes program funding, which is $500,000 in state funding. We received under our community services line item, which is basically enabling tech and innovation and emerging technologies, is another $500,000. So that doubles that budget. I'm really excited about that. We also received a program alignment director, and the total increase for that was $102,800. Then I also wanted to mention that TennCare received the ECF Choices 300 new enrollees, and that was $11 million in state and $32.6 million in total dollars. And so the total investment from the governor's proposed budget is $62.7 million for IDD investment, which is really exciting for our program. Thanks, Kara.
Thank you so much. Really appreciate that. Obviously, very exciting news in the budget for us, and we're excited to get started and continue the great work that we have here. One thing I do want to make a point of, that apparently the medication administration calendars are now updated. There was a misfire in the link. So if you would take a look there, you might be able to find the information that you're looking for. So apologies on that. Looking for everything else. I see the question, is that a full-time position? I'm guessing that's related to the TN START program. Dr. Davis, do you want to kind of answer that?
Yes. So, yes, these are full-time positions. What we're doing right now is we're interviewing for the assessment and stabilization managers. And so we will have 5 of those across the state. Those will be located in Memphis, Shelby County area. So they're working that West Tennessee area, Jackson, Nashville, and Knoxville and Hamilton areas, or Chattanooga. So we are hiring managers in each of those areas, and then we're also hiring for each of those managers 4 assessment and stabilization facilitators, or START coordinators, as START calls them, and they will be in each of those regions as well. So that's what we're hiring for right now. As of this moment, the registers are closed for those because we're doing the interviews at this point. But if we don't fill all the positions, we may reopen those at a later time. Kara?
Thank you, Dr. Davis. Sorry, I was having a hard time finding my mute button. There were to be new dollars available with the alignment. Will that be available in the coming year? Is it not in the budget? Andy, can you talk to this?
Yeah, absolutely. So the way that the additional funds from the MCOs, specifically the tax that they pay, having the 1915C waivers under them, will in the future be beneficial for IDD folks. So the way that works is that the first year, the unanticipated or the anticipated tax will be brought in as revenue, and then will be put back into the TennCare budget, which will then be dispersed to our population through our services. So long story short, it's not in the budget as is because it's not actual revenue yet. Thanks, Kara.
Thank you so much for that clarification, Andy. Going back to the TN START program, Bruce, will the TN START program serve a similar role as Project Transition? If you can answer that, that'd be great.
Yeah, so the 10 START ASTs are going to be a crisis response system, essentially, for people with intellectual and developmental disabilities. They'll be able to, when necessary, respond on site for people to assist staff in working with something that may have emerged for a person supported, or families who are having difficulties, or, really anybody. I think one of the distinguishing characteristics of the START program is that we're going to receive referrals directly from mobile crisis, in addition to referrals that may come from other sources. And so when they encounter someone with an intellectual and developmental disability in the community, at first we're going to stage in with people who are in services, but then as we grow and as we become more capable of adding more people, any referral for a person with intellectual and developmental disability is going to be something that we'll respond to. And so we'll be able to go in and help Mobile Crisis kind of sort through that and figure out, you know, what may need to happen for the person to the extent that they're part of our, you know, part of the IDD population and not somebody who is not in that, because that's not our wheelhouse. We work with people with IDD. We'll go on to develop a crisis plan for that person. We'll work with the whole system surrounding that person to develop that crisis plan, make sure the MCOs are involved, make sure Mobile Crisis is involved, make sure the police are involved if they have to be involved in given situations, and that the agency or other support network that the person has is involved. And so that crisis plan will outline, you know, where this thing needs to go and how we need to respond in the event of a crisis, and what all the things we do to prevent a crisis will be. The other aspect of this is that there's going to be a lot of clinical education. So in each of these regions, there will be clinical education teams, and an offshoot of that will be lots of education for different parts of the system, so that we can all kind of be operating on the same sheet of music as we go forward and try to support people with intellectual and developmental disabilities. The other aspect of this is all of those entities that we're engaged with. This is, I think, one of the real distinguishing characteristics of a START program is that we have been working already to establish memorandums of understanding, or what we're calling partnership agreements, with all of the MCOs, with all of the mobile crisis units across the state, with as many hospitals as we can get on board as we can. And so they're all going to be part of our network here. And when a primary aim is to make sure that we're not over-hospitalizing people, and sometimes we do that, and a lot of times we can't get a hospitalization when we need it. The whole aim of all this is, I mean, everyone said the whole aim, but a large part of the aim is making sure the person gets the treatment that they need at the time that they need it, and to be able to get those services when they are required versus you know, looking at other options when that's not required, and trying to make sure that people's lives are disrupted as little as possible by this crisis situation that they have encountered. So, Kara, in a nutshell, that's what the 10 START assessment and stabilization teams are all about. That's going to become, you know, we're going to be articulating that more as time goes by, but, you know, that gives everybody a pretty good start on it. And Michelle and I, Trey King, all of us are happy to answer any questions that people may have. So please send us an email or call us if you have further questions. Kara.
And we have time for one more question. So I'm going to go with Debbie Gonzalez's question. Could you provide an update on the EHR systems that you are continuing to assess for the single system design? So I'm going to turn that over to Andy. He's doing some work today during office hours, and he can talk about this.
Thanks, Kara. Another great question. Yes, we are moving forward with the procurement of an IT solution for the single system. Currently, we anticipate that to be Therap Services. As we've reviewed, they appear to be the best suited for our needs, and also that they're on the statewide contract, which helps. We're currently drafting a statement of work, which the process looks like this. So we'll draft a statement of work, issue that to Therap Services, and then receive quotes and cut a purchase order to the reseller that we have on contract. As part of this, the statement of work gathering, we are looking at working with Therap on the possibility of an aggregator for the use of providers' current IT systems, meaning that if you have a current IT system that you've invested a lot of money into, one of the goals of working with Therap is so that we can have an aggregator, meaning that there would be a bi-directional data transfer of information. So I know that's been a concern for many providers that have invested into their own IT system. Definitely want to work with you on that. And so hopefully this will be very seamless, and that it'll be a really good system for us and a very good system for the providers, and ultimately benefit the people that we support. Thanks, Kara.
Thanks so much, Andy. Appreciate it. Okay, so like I said, we do have a hard out today at 10 o'clock. So we are going to call it a day. But of course, you know, we'll be here next Wednesday to answer any questions that are on your mind. So with that, I'm going to turn it over to Commissioner Turner to say a few words, and then we'll see y'all sometime between now next Wednesday. And if we don't see you between that time, we'll talk to you on Wednesday. Commissioner.
Yeah, thanks, Kara. A lot of good questions today. Thank you for submitting those. And obviously, as the budget moves forward, we'll keep you posted on what that looks like through the legislature. Deputy Commissioner Kidd really laid it out there. There's a lot of good things in the budget. Our population is very important to the governor. We've had these conversations around how to support our community and what that looks like. So your feedback is always going to be important. I appreciate you sharing that, not just through office hours, but through other channels as well inside our department. So I appreciate that. Appreciate you guys staying in tune with Kara's communications and her team and recognizing what's coming from our office and the value that is presented from her team. So as Kara said, with that, we will talk to you guys next week. If we don't see you or talk to you in between then, have a great rest of your week, and we'll follow up next week. Thanks, Kara.
Okay, thanks all so much for joining us. I hope you find these weekly meetings productive. We certainly enjoy them and look forward to talking to you next Wednesday. Goodbye. Have a great week.